Why older cancer patients need a geriatrician? Hi, this is Dr. Armin Shirokni. I'm a geriatrician oncologist with 12 years of experience of taking care of thousands of older adults with cancer. Imagine you're in your 70s, 80s, or 90s, enjoying your time with your children, grandchildren, and your spouse, and all of a sudden, you feel an abdominal pain. The next thing that you remember is that you're in a CAT scan machine for a possible mass. The biopsy comes back as cancer. All of a sudden, it feels that the world has stopped moving, and the next day, it has started to move faster. Your friends, family members that you may not have seen for many years, all of a sudden has many opinions about how this mass should be treated or not to be treated. Do this, do that. This friend of mine did it this way and he suffered quite a bit. That friend of mine did it that way and he did extremely well. And you wonder who is right and who is wrong. You're worried about your age, your functional independence, your children, your home, your spouse. Will I become a burden on them? And then you meet a surgeon. The surgeon is a great one. After all, a very influential family member of yours made it happen. The surgeon talks quickly. You understand some, and you don't understand many more. And at the end, it doesn't matter, because by the time that you leave the surgeon's office, you have forgotten most of the things that the surgeon has told you. Your daughter asks you why you didn't let the surgeon know about your concerns, why you didn't share with the surgeon that you're worried about your quality of life, your functional independency, and you don't want to be a burden on your family. And you reply, why I should have told the surgeon? He's a great surgeon. He doesn't need to know my opinion. He's already too busy with everything that goes on in the operation room. That right there is one of the many reasons that every older adult with cancer needs to have a geriatrician. Years ago, we looked into our data on older patients' report of their functional activity during their preoperative evaluation. We assess this by measurements like activities of daily living, are you able to bathe, groom, etc., or instrumental activities of daily living, are you able to take care of your finances, are you able to take your medications. We found that while with the surgeons, only 5% of older adults with cancer reported any degree of functional impairment, when the same patients presented to geriatric clinic, more than 50% of those patients reported some degree of impairments. This is very important. Many older patients with cancer did not share their aging-related impairment with the surgeons, probably because those patients thought why the surgeon should care. But when the same patients presented to geriatric clinic, the clinic that is devoted to addressing aging-related impairments, they probably felt a lot more secured and welcomed to share those impairments. Now we know that those impairments can impact outcomes of surgery in a negative way. So those who did not share those impairments with the surgeons, and if they did not see a geriatrician, probably they did not share it with anybody, were more likely to suffer from the negative outcomes of surgery. So geriatricians and geriatric care providers do provide a lot of support for older patients with cancer, starting by letting you share your aging-related impairments with them so that they can address that fully and potentially reduce the negative impact of those impairments on your surgical outcomes. As a result, in my opinion, every older patient with cancer needs to have a geriatrician. In the description below, I will share 2 of the other videos that you may find useful and informative in how you should approach surgery and how you should look at your life as an older patient and as an older patient with cancer. If you're an older patient with cancer, or a family member or caregiver of an older patient with cancer, or if you're a cancer care provider taking care of older patients with cancer, please subscribe to this channel, like this video, leave a comment below, and hopefully I'll see you in the next video. Take care.